Good afternoon. My name is David Blackburn. I'm your Bell County Judge. This is our weekly press conference for COVID-19. I have several guests here today that I'd like to introduce to you and have them come to the podium one at a time. The first one is Dr. Amanda Chadwell, who is the Director for the Bell County Public Health District. She'll be followed by Dr. Jeremy Greenberg, who is the Director for Emergency Services at Baylor Scott & White. Ms. Travis, Kaylee Travis, is the Chief Nursing Officer for Seton Medical Center in Harker Heights. And then Mr. Kevin Roberts, who is the Chief Executive Officer for Advent Health in Killeen. So we'll have all of those come to the podium. They're going to make some comments, give you an overview from the healthcare provider standpoint. But what I'd first like to do is ask Dr. Chadwell to come forward from the Public Health District.
Good morning as opposed to afternoon this time. And what I'm going to go ahead and preface now is I'm not going to share the state and federal numbers because I don't think they've updated those yet, but I do have a preliminary Bell County number. We may add to that between now and 2. At 10 o'clock, we had 141. And I'm going to go ahead and preface, I don't have the male and female breakdown or the age group breakdown yet. Just really quickly to walk you guys through the way this works every morning, the reason we update by 2. When we get a confirmed case report, either overnight or first thing in the morning, what have you, we don't always have things like birth date. We may not know how old they are. We may not know what city they live in. We get just enough information to get the case investigation started, which is why it takes a little while first thing in the morning to gather all of that data to report it out. So I don't have all of that finalized. So again, 141. Tentative number, we may add to that. And if we find out one of those cases that was reported is out of jurisdiction, we may drop one too. So again, tentative. I do want to emphasize for the community the mask recommendation. I've had a number of people either email me or call and say, hey, I was at Walmart and I saw a whole bunch of people not wearing masks. And again, it's a recommendation, but I want to emphasize the importance of that. If everyone wears a mask, you're engaging in a protective measure for everyone around you. So please just an emphasis of that recommendation and how important that's going to be if you have to go out and about. And again, try not to go out and about if you don't have to. So there were some advanced questions that were directed specifically to me that were emailed. So I'm going to address these and then allow Dr. Greenberg to follow as Judge Blackburn stated. And if there are any other questions for me after everyone's presented, I'll address those as well. The first question was, how soon can people tested for COVID-19 expect to see results? That's going to depend on the laboratory that tests those samples. It varies a little bit from lab to lab. Some are faster than others. There's a process. Sometimes they have to get sent out and it can vary. What I can say is that the testing sites might not be in jurisdiction, and sometimes the laboratories will shift a sample and test it later based on the priority of other samples for a variety of reasons. So again, that's highly variable. It's kind of hard to give a hard number for that. The second question was, are racial and economic demographics available on those with confirmed cases? So yes and no. So some people don't elect to share that information. Racial and economic identifiers are voluntary. We ask, and not everyone is comfortable sharing that information with us, and it's not enforceable to make them share that information. So we don't have that data for every single case. Now, we do plan to share some information and some analysis of that when we can, once we have enough information to do something useful with it. I'm keeping an eye on that data and looking to see when's going to be the most appropriate time to share it based on, does it tell us anything useful? I don't want to just share counts that don't really mean anything. So again, keep an eye out for updates to the dashboard. That is something that I'm looking at to see when that's going to be useful. So no promises as to when, but hopefully soon. Killeen now has double the number of cases as the cases in Temple. When the virus started in Bell County, more people in Temple were coming positive. How do you account for the growth of the virus in Killeen and what's being done about it? So fairly simple. It popped first in Temple by virtue of Temple is on the I-35 corridor. We weren't surprised by that. It was expected. And we do have a lot more capacity for hospitalization in certain areas, including Temple. So it didn't surprise anyone that it popped first in Temple. It's not surprising either that we'd have more cases, especially double the number of cases in Killeen, because we do have double the number of people in Killeen. And there has been some additional testing made available as well. So that does lend to an increase in numbers. And let's see here. Can you provide a general analysis on transmission of COVID-19 in Bell County? For example, are people getting it while out and about, or is it more from contact with family members who may have caught it? It's variable. So again, we have community spread. What that means is you can get it by going to the grocery store. You can get it by going just about anywhere. So some people are not epi-linked. Some people, they come positive and we do not have the ability to track where they got it from because they got it just being out and about in the community. Some people have a direct link to a positive. We know about those. Some people have travel associated cases, and those are mostly early on. So it's really a variety of those things. And I addressed Colleen already, and ever hospitalized versus ever admitted to the ICU. So on our dashboard, one of the things we struggled with when we were designing the dashboard was how to share hospitalization information. We don't own hospital data. Hospitals are not required to report discharges to us. They're not required to report hospitalizations to us. So the reason for that is because it's very difficult to keep up with. That data changes by the hour. And we really struggled with, do we try and share active hospitalizations on the grounds that the number's probably going to be wrong within 15 minutes, and I don't like sharing inaccurate data. We compromised with ever hospitalized and ever admitted to the ICU because it does give a sense of severity and give a sense of the hospitalization rate for positives in our county on the whole. Again, keeping up with active hospitalizations and being accurate about it would be very difficult since we don't own that information. Now, something to bear in mind with ever hospitalized and ever in the ICU, don't double up on those numbers. If you want to know hospitalized versus ICU, if a person was hospitalized and they were in the ICU, that's not a double count. So if they're in the ICU, count them as hospitalized. I hope that makes sense. And based on the information available on the map, I have counted 12 cases in the hospital and 10 in ICU, not including county cases. Based on when that was posted, that's about accurate. Again, it's not going to include every single case because, as you noted, we don't map every single case for privacy reasons, but that's right about on point. It's a good representation. And I think that covers everything that was sent, at least for me, in advance. So let Dr. Greenberg.
Thank you, Dr. Chadwell. I'm going to do two things. I'm going to ask my interpreter to take one step backwards and half a step sideways. Thank you. That makes my comfort level raise just a little bit, but thank you. You don't have to get out of the screen. I still need you right there. You're perfect right there. That's good. Second, a couple other things that I wanted to do, and I should have done this before Dr. Chadwell came forward, but I want to make sure we kind of go over the process for today because I do have several folks here today. And again, I very much appreciate the representation from our healthcare providers in the county. I think this will be very helpful to all of you, but also all of the public to kind of hear directly from those representatives from each of those institutions and let them give you some comments and their thoughts and observations. I'm going to go through some of the questions, really all of the questions that we received in advance. Dr. Chadwell's already touched on some of those, but I want to make sure that our healthcare providers have an opportunity to at least hear those questions in advance. And if their comments can address some of those, that's great. If not, we'll try to circle back at the end and try to pick up on some of those questions so that we do answer those as adequately as we can. The other thing I wanted to mention, one of the questions I know that many have had across the county is the total number of tests that have been run in Bell County. And I have a number for you today on that. We're not breaking that down by hospital care facility necessarily, but I can give you a total test run as of April 22nd, 2020. And that number is 3,199. That's across the entire county, 3,199. All right. That's the total number of tests run in Bell County as of yesterday. All right, questions that we've received in advance, again, of the press conference. And I'm going to probably mention a couple of questions that I get kind of frequently throughout the week, and I'll try to address those also. First question, which Dr. Chadwell addressed, how soon can people tested for COVID-19 expect to see results, and who provides results to the person? Is it the testing site, is it the county, is it the state? Second question is, are racial and economic demographics available on those confirmed cases? If not, why not? How can those be gained? How can we get them? Are demographics available on who is tested, or are they available on who have died? Next question has been, are you currently doing blood tests to check for antibodies? Will you start anytime soon? If not, how will you choose who to test for this? Next question was, do you foresee offering at-home test kits, and when would these be available, and how would a person acquire them? Next question was, Killeen has double the number of cases of Temple. When the virus started in Bell County, more in Temple tested positive. How do you account for the growth of the virus in Killeen, and what's being done about that? Next question is, can you provide a general analysis of the transmission of COVID-19 in Bell County? For example, are people getting it while out and about, or is it more being in contact with family members who have caught it? Next question is, why are the number of infections in Killeen growing? Is it simply a matter of having a drive-through testing facility, additional testing? Next question is, there's been a lot of talk about reopening businesses and returning to some sort of normal. What do you say to residents who have concerns about that process, and is it too soon? And then the last question, at least that we got submitted from the press corps prior to the meeting, was, during recent workshops, you've talked about the county acquiring test kits. How many have been acquired, and what's the county's plan for testing those kits? The last two questions I'll certainly try to address when I get back to the podium. But anyway, those are the questions we received in advance. And again, I wanted to let the healthcare providers kind of hear those, and hopefully we can address those during their comments or after their comments are completed. So with that, I'd like to call Dr. Greenberg to the podium. He's Director of Emergency Services for Baylor Scott & White. Doctor.
Thank you, Judge Blackburn. Appreciate the opportunity to come back. I guess it was 3 weeks ago that I was here. Seems like this has been going on forever. When we look at it, it's actually been 2 months that we have been preparing within the community and within the institution for something that we hope does not occur. And currently, it looks like things will certainly not be as bad as we thought they were going to be. Some people would say that we didn't need to do what we did because things aren't so bad. It's very, very much more likely that things are not as bad as they are because of what we did. I know this has been really hard on everybody. It's really hard on businesses and hospitals. Healthcare facilities are no different than other businesses. We've been highly impacted by this. Currently, 90% of our business is not related to COVID, but we have probably put 110% of our attention at preparing for COVID, just like our fellow other facilities in the county and in the nation and the county. We've worked very closely with the county to discuss the care of our vulnerable populations as well as everybody else in the county. I will give, since there were so many questions, I'm going to give some quick stats, and then I'll probably address a couple of the questions and go from there. As for testing, the Judge Blackburn gave the cumulative numbers for the entire county as of yesterday. For Baylor Scott & White, Temple area, for Bell County, so there's some qualifiers there. We have performed 2,520 tests with 102 positives, so that's a positivity rate of 4%. We could talk a long time about how you interpret that, though, because you have to know who we were testing at any given time, and that who we tested has changed over the last month or so. So that's a whole different discussion. Currently in Temple, we have 13 inpatients at our Temple Medical Center. 7 are in the ICU. 6 of those are on ventilators. There are 6 on the med-surg floor. Our inpatient census is running at about 70% of what we would consider normal. Our emergency department census is running at about 70% of normal, which is actually higher than most other hospitals in our system and most other hospitals. Most hospitals are 50% or less. In fact, our children's emergency department is running at about 30% of normal. Our procedures and clinic visits are also down to 30% of normal. And currently McLean has no children inpatient that are COVID-19 positive. To answer some of the questions that were brought up, specifically the question about community spread versus household contact, the answer is both. So as you go out in the community, you will be exposed to other people. You'll be exposed to areas that other people have been in where the virus is present. You can pick that up and take it home. Household contacts is a much higher risk than community contact, but the way you get it into your household is from the community. So that's why both are incredibly important. And that's why when you see things like nursing homes you can get very quick spread because those are essentially household contacts. Question about testing. Previously, when we've talked about testing, we've been talking about antigen testing, testing for actually part of the virus itself. Now, within the last week or so, it has become available what's called antibody testing. The antigen testing, testing for the virus, is done with a sample usually through the nose or some through the saliva. The new antibody testing is a blood test, and it tests for the body's immune response to the virus. So it takes some time for that to become positive as somebody has become infected. The utility of that test in simplest terms is to test someone who has no symptoms or was previously infected to see if they have developed immunity. But even at this point, we don't know that having that test positive is going to protect you from additional infections. And I think that was all of the questions from there. Do you want me to come back for other questions or take them back? Okay. I think that's all I have for now. Thank you.
Thank you, Dr. Greenberg. And again, I'll kind of run back over the questions after all the healthcare providers have had an opportunity to offer their general comments, and hopefully make sure we've addressed in some way, shape, form, or fashion the questions that have been asked. At this time, I'd like to call Ms. Travis, who is the Chief Nursing Officer for Seton Medical Center in Harker Heights.
Thank you. Good morning. First thing I'd like to do is thank the community for their support. It's been incredible, the outpouring of support that we've had from local businesses, many restaurants. They've definitely fed us well. And they've just been very, very gracious in how they've treated the facility. Something I do want to say is that I know there's a lot of questions and comments about testing. I want to remind everybody that this is a new virus. This was something new for us, for the whole world. And there's been, concern that we weren't ready and things like that. And when you have something like this, as infectious as it is, and certainly appearing to be quite as lethal as it is, it takes a little bit of time to ramp up. And that's what we've been doing. We ramped up pretty quickly. We're fortunate to be part of a company that has a pretty good supply chain, but even that supply chain took time to catch up. So we have never been without PPE. We've had adequate supplies, and we've been able to get what we've needed. We do ask our providers to be very cautious. We don't want anybody getting sick, or we don't want to lose our providers to being out with the virus. So in some cases, there are times that they are conservative with their masking that they use, because it just helps us with our supply. And but we never ask them to not be fully clothed and in full PPE when they're caring for a COVID patient or a suspect patient. Things have gone well. I agree with Dr. Greenberg. We've seen a dramatic decrease in our volumes. Our emergency room, which we average between 145 to 160 patients a day, is now down 50%. Our inpatient volume is certainly lower. Our surgeries we had suspended except for emergencies, and that everything across the facility has decreased. I think it's very true that it's not been as bad here because of the actions that all of us took right off of the bat, making sure that with the social distancing, the hand washing, the immediate thing we saw when these practices were put into place was a decrease in just the normal flu. So these are things that we should be doing every day and taking care of ourselves. And I do want to say that we have 2 nurses in our facility that are cath lab nurses that had previous experience in ICU that have gone to New Jersey to help one of our sister facilities that's just getting hammered with this virus. And I applaud them, and I just want to recognize them. They just recently came back and quarantined for 14 days. They're healthy. They've brought a lot of good information back to us about the things they saw and how the patients were being cared for. And they actually volunteered to go back. So I couldn't talk them out of it. But those are really my initial comments. So if you have any questions, we'll see if I can answer them.
All right, thank you.
You bet.
We'll come back. Again, we'll come back to questions here in just a moment, but I'd like to give Mr. Kevin Roberts an opportunity. He's the Chief Executive Officer for Advent Health in Killeen. And I'd like to ask him to come to the podium.
Thank you, Judge Blackburn, and it's a pleasure to be here this morning to talk about our COVID update. I would be remiss if I didn't tell you the latest in fashionable attire. Don't go anywhere without your mask. I don't. I'm a registered nurse and a hospital executive, and I know that the sneakiness of this virus cannot be overestimated, so be prepared. So Advent Health is the part of a large faith-based not-for-profit health system across the eastern United States, and we are joint venture partners with Baylor Scott & White, and we appreciate all the great resources and collaboration that brings into our network. The faith-based component of our purpose and corporate culture has really carried us through this entire crisis because we have depended on God for his protection, his wisdom, his strength, his courage, and we continuously give him praise and credit for the state of affairs that we are in. On behalf of the healthcare providers of Advent Health Central Texas in Killeen and Advent Health Rollinsbrook in Lampasas, I want to say thank you to the citizens of Bell County and Lampasas County, because we stretch over there, for their cooperation in the guidance of the sheltering in place orders. I remember the day that Judge Blackburn, the very day that we had the very first case, Judge Blackburn said, this is the time, and that was the right decision, and I thank him for it. And now you cooperated with this, and you are our heroes because you bent the curve by preventing this virus from spreading faster. The social distancing, hand washing, and self-isolation when you're not feeling well, it really works. And as these restrictions become lifted by the governor and others, please be careful, wear your masks. We also want to be thankful for the outpouring of love and support from our community. There are too many donors and institutions to name, but your gifts of food, gift cards, homemade decorative masks, personal protective equipment, and a lot of other stuff has really brought courage to our doctors and nurses, technicians. You did drive-by honking caravans, all kinds of stuff, and every time that did not go unnoticed. Our health system, Advent Health, has made safety and security of our healthcare team its top priority as well. And to my knowledge, we have no exposure that has resulted in any infection of any of our healthcare providers to date. And there are many things that we've done to protect not only you, but our healthcare team. One of those things is the PPE. As Callie mentioned, we have never been without PPE, and that's a tribute to our health system and all their great supply chain efforts. We also have protected and maintained the wholeness of our team members by not having any layoffs or furloughs. Now that's across 80,000 team members in 50 hospitals in the eastern United States. We guaranteed our employees would receive their base pay through June 6. This required a lot of creativity and what we call redeployment in the hospital, nurses doing temperature checks or drive-through screening and all sorts of stuff. But the spirit and cooperation of our team members has been extraordinary. We provided childcare for team members who couldn't take care of their own children because of the closure of the schools, psychological support, relaxation rooms, scrubs and showers for the team members. If they were going home and they felt, oh, I just can't go home in these clothes, they were able to go home, go down, take a shower, put on a fresh pair of scrubs, and go home feeling refreshed. The silver lining around this whole thing has been the innovation and the acceleration of process improvement that our team members have experienced. We've advanced telemedicine, video visiting, respiratory screening, and testing at both of our hospital ERs. So now let me go specifically to the topic at hand, and that is testing. Advent Health has 3 testing platforms, and we have never been without a testing option. First, I want to give a shout out to Baylor Scott & White. They have been our best and most reliable resource throughout the crisis. So they have been our reference lab from the beginning. We also now have in-house rapid testing called a machine called Cepheid. And we can do that in very short order in about an hour. Now, we save those limited test kits for the patients that have the most severe disease. So you can't come in and say, I want a rapid test. But we do have now a drive-through option using saliva. And if you saw the president talk about the swabbing, that apparently is not a very fun thing. But the saliva test is what you would experience through our drive-through testing in Killeen, Lampasas, and Harker Heights. We have plenty of those test kits. Now, this is done for people with symptoms or known exposure. So this is not random testing yet. Someday we may get there. I know that's a big national conversation, but for the time being, we have an abundance of these test kits for saliva testing. So if you would like a test and you fit those criteria, you've got some symptoms, or you've been exposed to someone that has known COVID, you can call 254-519-8500 and make an appointment. And then you just drive through. You never get out of your car. It's a very sophisticated system. I'm pretty impressed with our people. You need to bring your photo ID and your insurance card if you have one. But there will be no out-of-pocket costs, and no one who fits criteria will be denied testing. So that's really what's important for you to know. So if you need that test, come on by. For our testing quantity, we have done about 575 total tests in our network for people with symptoms. That's through our emergency rooms, both emergency rooms and these testing drive-through clinics. And about 5% of those are testing positive, very similar to what Baylor Scott & White is seeing at their conversion rate. We are having very few admitted to the hospital. In fact, we have no known COVID patients in-house right now at Advent Health Central Texas. But the virus is out there. Don't ignore your symptoms and go to the hospital if you're sick. During one portion of this cycle, we noticed that there weren't a lot of patients at the hospital, but the ones that were coming in were really sick, and they didn't necessarily have COVID, but they had allowed their pneumonia or other conditions to get really bad before they came. So don't avoid the hospital. We are protecting ourselves. We will protect you. We'll be reopening our hospital services, the elective surgeries and so forth in the next week or so in response to Governor Abbott's latest executive order. And the safety of our healthcare workers and of our patients will be the top priority. So there will be more information to come on that. So in closing, I just want to say thank you for being an amazing community, for taking the right steps to be safe, and for supporting your healthcare community. God bless you all. Thank you.
Thank you, Mr. Roberts. All right, what I'd like to do now is I'm going to circle back to those questions that I read at the beginning, and or at least some of them that I think we either maybe didn't address or maybe we can expand on just a little bit. And I'll look across the room here, and I'll probably ask, if I don't see a volunteer come forward, I will pick on somebody to come back to try to answer that. I'm going to answer or try to answer this first one, and I'm going to look for them to jump up and tell me that I've just misstated this or said this wrong if I'm incorrect. But one of the questions was, how soon can people tested for COVID-19 expect to see results? And then who provides the results to the person? It's my understanding that the vast majority of tests that occur, you can usually get those results back within 24 to 48 hours. And the person who provides the results of the test to that person is the healthcare provider who ordered the test. And I'm getting head nods across the room, so that's correct. So that was one of the questions. So again, 24 to 48 hours for test results back once you're tested, and it's your healthcare provider that will give you those results when you get back. These next couple of questions, I'm probably going to look and see if somebody else can come back to the mic to answer these, because I'm not sure I know the answer to them. Dr. Greenberg mentioned that I think Baylor Scott & White has begun doing some testing for antibodies. And the question responded or made several comments along those lines. I don't know that I heard an answer to the question about how people or subjects are chosen for those antibody tests. Can you address that? He's on his way back.
Yeah, I would have just given Judge Blackburn the answer if it was a short one. just like the antigen test when they started out, the antibody test is in short supply to begin with. Advent will start on May 1st testing for antibodies. So the target to begin with for testing will be those people who you think may have already been infected and may be returning to work or returning to an environment at home where there is somebody that is very high risk for COVID. So you can use that test again to see if that person has already been exposed. I'll put a caution out there too, because some people have asked about this test. Well, if I get my antibody test and it's positive that I'm immune, do I no longer have to wear PPE? Do I not have to wear a mask? Can I just, go about my life? And the answer to that is no. It does not. At this time, we don't know that it protects you. Additionally, you're still a risk to other people. You can still be a carrier. So the utility of the test is to show that someone has previously been exposed, because remember, a lot of people have no symptoms with this disease, and also to help us with getting our workforce back in, knowing if they've been exposed or not.
Thank you, Dr. Greenberg. I'll look to the other two, see if they wanted to add anything to that or correct Dr. Greenberg. Okay. Thank you, Dr. Greenberg. The next or the last question on at least the advanced questions we got that I don't know that was addressed, and again, I'm going to need some, I'll look to someone to help. Maybe Mr. Roberts can take this one. Do you foresee offering at-home testing kits? And I'll just let you come back to the podium.
We have not heard or been identified any source for a home testing kit at this time. The drive-through process is simple and very well organized. And so the thing about specimen management with laboratories and so forth, there is processes whereby you have to take care of those specimens. And we have that well organized. So I haven't heard about any home kits. The other thing about this, and this might be Dr. Greenberg's forte, but just because someone says they have a kit doesn't mean that it's going to be a valid test. So there's probably going to be some quacks out there over time, but right now I think you're pretty safe going to one of the hospitals and getting tested.
And Dr. Greenberg, do you have some comments on that?
So I agree. I have no doubt that the availability of purported home testing will show up on an internet near you. It is definitely technologically possible that you could have those. I mean, there's no doubt that you could get a saliva sample or a nasopharyngeal sample if you want to push a Q-tip all the way back in your nose, which is actually one of the reasons a test will be falsely negative is poor collection. So I have no doubt there will be at-home tests offered, and I would put a big buyer beware because just like we talked about with PPE and we talked about with masks, right now you can buy a mask from lots of places and they're probably totally ineffective. So buyer beware. Don't buy a bad mask. Don't buy a test that's bad and then act on that, because a bad test or bad protection is probably worse than none whatsoever.
Don't go too far. What's a bad mask?
So there's, Judge Blackburn was asking, what's a bad mask? There are a number of masks purported to have just as much protection as the N95 mask. The most common one out there is a KN95 mask. And I'll go ahead and say that from my experience and experience in communication with others, those masks have failed miserably in the healthcare environment to what's called a fit test. So when you have an N95 mask, it's very important that you fit test it for each individual person. And that's beyond explanation here, but just putting the mask on doesn't help. You have to make sure that it fits well. The experience has been with these masks where people are offering large numbers for a fair amount of money, is you get them in and they're either, the bands are not correct, they're broken, they won't give you a tight seal, or they just fail the fit test. So the problem is if you don't do the fit test and you have a bad mask, you're walking in there without no mask whatsoever. And a false sense of security is very dangerous in this situation.
Thank you, Doctor. A couple more questions, and these. Thank you to the Texas A&M system for donating those to the county. We've also purchased some from a private vendor. These kits have been purchased for use primarily for what I call our frontline county employees, our first responders. They've also been allocated, or there's been some allocation for decedent testing when circumstances warrant such should occur. The protocols for accessing or testing from those kits are very similar to what the testing protocols are in the private sector, which is symptomatic based. Another question that I received was, there's been a lot of talk about reopening businesses, returning to some sort of normal, and what would I say to residents about concerns they have about that process and concerns that it might be too soon. My first comment, and I'm going to elaborate that here on this in just a moment, is that those decisions about reopening and the process for reopening are in the hands of the governor. But he has indicated that his prime concern and prime data and factors that he looks at are going to be based on the science and data that his health authorities are providing to him, and that the public safety is still the prime directive and the prime objective in any reopening plan. I'd urge you to tune into his press conferences. He holds them at least once a week, sometimes 2 and 3 times a week. And I think he reiterates that message at the beginning, at the end, and throughout all of those press conferences about what drives his decision-making process as he puts forward a plan to reopen the state of Texas. So along those lines, I do have a few comments I wanted to make. As many of you know, last Friday, the governor did issue a series of new executive orders. One that I want to talk about in particular is Executive Order GA-16. I'm going to read portions of this, but not all of it. But I think it's very significant. It's the broadest executive order of the 3 that he issued last Friday. And this one has to do with what has become known as retail to go or reopening Texas. The first thing I would highlight out of that order is that the governor maintained that every person in Texas shall, except where necessary to provide or obtain essential services or reopen services, minimize social gatherings and minimize in-person contact with people who are not in the same household. So the statewide stay-at-home order still remains in effect per the governor's order. However, the governor did add some provisions in his order addressing reopened services. And as of midnight tonight, retail services that have not been deemed essential services, but that can be provided through pickup, delivery by mail, or delivery to the customer's doorstep in strict compliance with the terms that are required by the department, by DSHS, which is a separate document, but also available on the state website, may reopen under those terms and conditions. And that's what's been colloquially referred to as retail to go. In addition, in providing or obtaining essential services or reopen services, businesses are supposed to follow the guidelines from the president, from the CDC, and DSHS. He's also issued his office and the Attorney General's office have also issued some new guidelines for faith-based religious services and how those can be conducted. Previous general orders identified church services and worship services as essential services, but did issue some guidelines and recommendations associated with that. And again, some of those were just recently reissued within the past day or two. The governor's order, GA-16, also maintained closure for eating or drinking at bars, restaurants, food courts, visiting gyms, massage establishments, tattoo studios, piercing studios, or cosmetology salons, provided that the use of drive-through pickup or delivery options for food and drinks is allowed and highly encouraged throughout the duration of his executive orders. Again, he reemphasized in his order that it does not prohibit people from accessing essential or reopened services or engaging in essential daily activities. And he lists some of those, like going to the grocery store, gas station, visiting parks, hunting, fishing, engaging in physical activity, so long as the necessary precautions are maintained to reduce the transmission of COVID-19 and to minimize in-person contact with people who are not of the same household. The governor's order also extended or maintained the prohibition against visiting nursing homes, state-supported living centers, assisted living centers, long-term care facilities, unless to provide critical assistance as determined by the Health and Human Services Commission. The governor's order also extended the closure of schools for the remainder of the 2019-2020 year. And finally, he made mention of private schools and institutions of higher education should establish similar terms to allow teachers and staff to return to schools to conduct video instruction and perform administrative duties remotely from home. That's, again, part of the text of his general order or 16 or executive order 16 relating to COVID-19. At this time, as I announced on Monday of this week at the Commissioners Court meeting, there are no Bell County orders or directives that are in effect. My intention is to simply follow the governor's orders. As I read his latest round of executive orders, local orders would probably only do one of two things, or both. One is they might confuse and frustrate folks even more so with an additional layer of rules and regulations that might need to be observed in addition to the state orders. But more importantly than that, I think the governor's orders have superseded or preempted any local orders that I might issue anyway. So my intent is to follow the governor's orders as he rolls those out, which brings me to my next comment on the governor's orders, and that is he's indicated that there will be a series of orders or a phased-in approach to what he's calling reopening Texas. So I would anticipate that to occur probably on a weekly basis going forward. I don't know that. It's certainly going to be up to the governor as to the timing of when he rolls these out and rolls forward. The latest information I have is that we probably should expect another round or executive order as early as perhaps Monday of next week, and maybe earlier than that, but he's indicated Monday, April 27th might be the next date that another executive order might be issued. Another question that I have gotten has been on complaints or compliance efforts and enforcement efforts associated with what is now the governor's orders, which local law enforcement officials are charged to enforce those orders as they are state law. Right now, as of yesterday, I can tell you that we had 201 complaints or requests for investigations into compliance with the orders. That breaks down to 130 received at the county level. We had 56 from the city of Killeen, from their code enforcement division, 5 from the city of Temple, and 10 from Harker Heights. But the total is around 201 complaints and or investigations that we've entered into relative to compliance. The last 2 things I'd like to mention. One is Bell County website. We continue to update that, so there's links there that get you to other places, as well as the Public Health District website are good sources of information for local information. Of course, the CDC website and the DSHS website both have a lot of information and dashboards available for COVID-19 also. Last comment I'd make on information, you can still call our local COVID-19 hotline number, which is 254-933-5203. That number is being forwarded automatically to 211 at the state level, but they have all of our local information. They can answer questions associated with that. And then we check that, or we check back with 211 on a regular basis to make sure we know what those calls are and how they're being responded to. I will say I didn't bring the counts in with me, but I think our call volumes have continued to be pretty low. I think for the total of this week, it's been about 30. around 30 Monday, Tuesday, and Wednesday, I guess, is the total. So again, those vol volumes have been down pretty substantially since when we first opened that COVID line. Last thing I would say, and then I will open it up to questions, and we'll try to address those, is you've heard this from our healthcare providers. You heard it from Dr. Chadwell also, but I would urge folks to continue to wash your hands frequently. Stay home if you can. If you do need to go out, then actively practice social distancing when you go out. And when you do go out and you go into what I would call densely populated areas like a Walmart or an H-E-B, you certainly need to be wearing your face coverings. All of those measures taken together are your best defense against this virus. All right, with that, I'll be happy to open the lines up and take questions or direct questions. It's hard. Are the phone lines open? Okay.
I'll go first. You just said about the compliance complaints. What has happened as a result of those compliance issues? Any tidbits? Kind of what's happened?
No, to date, it's a good question, and thanks for it. To date of the 201 complaints and compliance investigations that we've done, I'm not aware of any citation that's been issued or any court proceeding that has resulted as a result of that. And what that says is we have seen really outstanding compliance by our business community when they're approached by our law enforcement officials. So I want to say thanks again to our business community for the work they've done toward compliance, and they continue to work very hard in that respect.
Okay, thanks for the Omar here. So you guys spoke about Bell County and small businesses. I wanted to know if anything is being done to help small businesses, any loans, grants, things like that.
Yes, good question. There is a myriad of assistance programs available. Most of those programs are coming from the federal government. I'm not going to be able to stand here and list all of those, but I would urge folks who have an interest or a need to access those programs to go to really their Chamber of Commerce websites. I think I've looked at every Chamber of Commerce website in the county the past day or two, and all of them have a ton of good information on there and links to information about assistance programs, either at the federal or the state level. But I believe most of these programs are going to be federally managed. There may be a state component to them. But what I would urge you to do is go to Temple Chamber of Commerce, your Killeen Chamber of Commerce, Harker Heights Chamber of Commerce, Belton Chamber of Commerce. They have tons of information on their websites to help small, and in particular, small businesses.
Okay, thank
One
you.
of the things the governor talked about on Tuesday, I guess it was the number of drive-through testing locations and the lack of awareness by the public of how many there are. Can you talk about how many there are in Bell County, and are there plans to open more, either on the county's behalf or part or the hospitals?
Thank you. I'm kind of looking to my healthcare providers to validate for me, but and I may ask one of them to come up here. They can probably address the test sites. I think Mr. Roberts already addressed. I think they have one, two.
We have 1, 2, 3 drive-through sites. The main one is at the hospital in Killeen, but we also have a clinic in Harker Heights and one in Passes.
Okay, so Mr. Roberts was indicating from Advent Health in Bell County, they have 2 drive-through locations. If I need to get him back up here to give the addresses for those, I'll do that. Matter of fact, I think I will. If you'll come back up, just again, repeat what you just told me. And if you can give us the locations of those drive-through sites, that would be helpful. And then I'll ask Dr. Greenberg and Ms. Travis to come forward if you have a drive-through site. I don't think. Okay. Yeah, I'll ask all of them to come back up and tell you what their plans are for drive-through testing. Okay.
Thank you, Judge Blackburn. Yes, I was wearing my mask while I was sitting down. So the main testing site is at Advent Health Central Texas on Clear Creek Road. That's 2201 South Clear Creek Road. And the other site is in Harker Heights at one of our physician clinic offices. I'm sorry, I don't have that address, but the call-in number for setting up an appointment, you could select either site. And I'll repeat that number, 254-519-8500, and you can make an appointment to drive up and get those tests done. That's nice. You're welcome.
So when we talk about drive-through sites, I think it comes to mind, people think they can literally just drive up, get tested and go. There are, to my knowledge right now, there are not any of those.
No, that's fine.
All of the drive-up sites are, and I would say they're called testing sites, or really sampling sites. So the drive-up sampling sites for Baylor Scott and White, you access through our app or through the website. And you do what's called an e-visit, and based upon your symptoms, a test may be ordered. We actually have two sites in Bell County, I forgot. One is at the Temple Pavilion, which is on 31st Street near the main hospital, and the other is at our Killeen Clinic in Killeen. I also know that there are some of the other medical facilities in the county that are starting to do some drive-through. I'm not sure if they're starting up yet, but I know there are some others coming, so you'd have to watch the news and watch social media.
We'll be opening our drive-through at the Wellstone building, which is right next to the hospital. We are asking that you call 618-1020 to schedule a telehealth visit and then go through the screening process with them, and they'll make the recommendation on the screening process. And that should, our press release is coming out probably tomorrow.
Thank you all. So and I may have lost count there, but I think I heard 5 sites in Bell County through those 3 healthcare providers that are available, again, under certain protocols. Again, as Dr. Greenberg indicated, you need to meet those protocols and follow those processes. But there are 5 sites for testing. And in addition, I was just advised that Premier ER, which goes along with what I think Dr. Greenberg said, that there may be some other healthcare providers in the area soon to open, but I've been told that Premier ER at 7010 West Adams and Temple will be doing some drive-up testing. Again, I don't know what the protocols are for that, but they'll be doing some drive-up testing, or that will be available at that site. So again, I think you're going to see, from my perspective, I think we're going to see more and more of that across the county, across the state. The governor announced, I think last week or early this week, that he was deploying some National Guard troops, I think around the state, 20-something sites where there were going to be testing done through that unit or those units, again, at various locations around the state. So I think there's going to be a pretty significant ramp up across the state. And I think the governor's indicated that that's part of the plan for gathering the data to make decisions on next steps and phases as we go forward. Next question.
Yeah, Judge. So during shutdown orders, it was kind of left up to local counties to decide how strict they wanted to be, when they wanted to enforce that, not just necessarily going off of what the governor said, because he was saying, it's different in every area. Do you see that being the same for opening up, or do you plan to just follow what he says for opening up, no matter what's happening here in Bell County? I mean, what could that look like?
Yeah, that's a good question. At the present time, and based on, again, his most recent orders issued last week, I don't see very many options for local orders to be in place. He's indicated, the terms and conditions now for both essential and non-essential services and activities. So I don't think there's much room in there right now, anyway, for what I would call a more tailored approach on a county by county basis across the state. Now, that said, the governor could, and I don't know that he will do this, but the governor could next week announce his next phase that does allow for a more tailored approach, so that, just for example, perhaps if your threshold for the number of positive cases that you have or the number of tests that you've done indicate a certain trend for a certain number of days, those indicators will vary from county to county across the state. And so it won't be the same in Dallas County as it is in Harris County, as it is in Bell County, or as it is in Brewster County in West Texas. So the governor could move forward in that direction in the next phase. And if he does so, and if there are allowances made for some tailoring of a local response based on whatever that criteria is, then certainly I will re-examine that, and we'll look at orders that could be issued out of my office that would tailor it more to Bell County and more what we're seeing in Bell County rather than the current approach, which is statewide. Next question.
This question's for Baylor, Sodom, Hawaii, and Seaton. You know, we've heard across the country there have been furloughs and layoffs with medical employees. Governor said yesterday, I think it was yesterday, that Baylor, Sodom, Hawaii is hiring more people. What is going on locally at those two facilities in terms of layoffs and furloughs and hiring?
So there have been, when we say furlough, that means that people are allowed to go home, but they are still being paid. So much like Advent, our organization has guaranteed everyone's reimbursement, everybody's salaries through the end of May. But this has been a huge financial hit for all healthcare providers. So the reality is that we're looking at our finances. There are no current plans for what's going to happen. But unfortunately, that may come to pass. At the same time, yes, we do have openings within our system for primarily healthcare providers. We are absolutely still providing healthcare. But as everyone knows, this situation has completely changed the way we do business and the way we will probably continue to do business. So we do not have any solid plans right now. There's no percentages or anything else, but we are definitely looking to see how we can remain viable, just like every other business in the state.
We're pretty much in the same boat at Seton Harker Heights. We have Ardent Health Services is our company that owns us, and they have guaranteed our employees that they are at home, and that they have their paychecks still coming, and also benefits. So we're hoping to be able to bring them back as you know, our volume increases. And at this point, it's a question as to what's going to happen.
All right, thank you. Any other questions?
Is that okay?
I'll let her go.
Thank you. A question back to testing. I'm curious if this is the first time we're getting these numbers. So I'm curious how they've been collected and if that's going to continue, if that information will go on the dashboard, how often we're going to get an update on testing.
Okay, thank you. I think I can address that. And again, I'll look across the room to my healthcare providers to correct me if I misstate. That information historically, at least up to today, has always been collected, but it's been collected at the individual healthcare provider facilities, whether they be public or private, which again, as you've heard us say from week to week, presents a little bit of a challenge at the local level to assimilate those numbers into one number and then report those with any frequency and or accuracy. We think we have worked out a process now to where we'll be able to report those numbers on a daily basis. I can't tell you that we'll have those tomorrow, but I think hopefully beginning as early as next week, we can begin to report on a cumulative basis the number of tests that are occurring in Bell County. And so hopefully we can do that going forward. The state, again, has been receiving that information. So at the state level, the dashboards there have reflected that. But again, there's a myriad of private testing capabilities and facilities across the state, even across Bell County for that matter. So it's just taking a little bit of time to kind of get that assimilated and hopefully reported in a fashion where we can give you a single number on a daily basis.
Thank you.
My question was, have y'all received any guidance on the primary runoff elections?
On the primary runoff, you're talking about July?
Yes.
Yeah, July 14th, I think, is the date for the primary runoff elections. I have not seen any additional guidance from the Secretary of State's office. I did talk to our elections administrator a few days ago, and I think as far as we know, that is still the date, and it is there's not any changes that we have seen or been propagated anywhere with the Secretary of State with regard to how those elections will be conducted. But let me add quickly, July 14th, especially in light of the past 30 or 45 days or so, July 14th seems to be a very long way away at the moment. And so things, I would anticipate, I don't know this to be the case, but I would anticipate that we're going to get some additional guidance from the Secretary of State's office on elections before July 14th. And I don't know what that will be.
Do you get any communication from Fort Hood on the number of cases on post, or is it completely, you get nothing from them? So I know they have to report to the DOD.
Yeah, I'll make a quick comment, then I'll ask Dr. Chadwell to come forward and she can address the number of cases and the reporting process and all of that from Fort Hood. But I want to say very quickly anyway, I have regular discussions with Fort Hood command staff. Garrison commander and I have talked a number of times. Communication lines have been very good. He's apprised me of what the post is implementing and the process that they're going through. So we have very good communications with Fort Hood, and I very much appreciate the phone conversations that we've had to date. But let me ask Dr. Chadwell to come forward and she can talk to you about the reporting process.
So when it comes to Fort Hood, I do not share Fort Hood's data because it is their data. They share with us information about cases that live off post, that live in the community, and those numbers are counted in our numbers. If they live on post, they are DOD's responsibility, DOD's data. They handle their own investigations. They have their own public health system. So for that reason, we do not count that information. They do report it to the state, but we do not get reports about on-post cases. We do communicate with them regularly, and we do offer advice when it's asked for, and we do get information from them back and forth, but we don't get reports on those cases, which is why we're not sharing it.
Thank you.
Any other questions before I'll certainly continue to take questions as long as you have them. But I wanted to mention something that I didn't mention earlier in terms of contact points or information points. One of the things the governor has announced is an email address whereby businesses can submit questions and or suggestions about his reopening plan, concerns, whatever it may be. That email address is local.input@gov.texas, spelled out, .gov. One more time, that's local.input@gov.texas.gov. And again, the governor's indicated that his office already received lots of email from businesses across the state with suggestions and recommendations and thoughts and ideas about reopening. And so I would encourage businesses to take advantage of that opportunity to provide some input on his policymaking decision process. Next question.
Do we feel that based on thousands as done in the county, are you all confident that that's of the cases we have from those test numbers, are we confident that's an accurate representation of how the pandemic is hitting in Bell County? Are we happy with the test numbers, basically?
I'm going to rephrase the question and then look to my healthcare providers to see if they can maybe address that better than I can. But if I understand the question, I think it's whether or not, if we've done 3,199 tests as of yesterday in Bell County, do we think that that is an adequate number of tests for assessment purposes going forward? I mean, in terms of whether or not the virus has peaked, whether or not we're still climbing, whether or not it's time to begin looking at reopening, those kinds of questions. But just, is that number adequate for those general types of discussions and concerns? Is that accurate or close?
Yes.
Okay. All right.
Yes.
I'll ask, Mr. Roberts looks like he is anxious to get to the podium, so I'm going to bring him up.
Well, I don't want to dodge the question at all, but I want to just say that all of your providers in the community have all the testing they need. We're testing every person that comes to us saying, with the fever and the cough and other types of kind of esoteric symptoms. We're not being all that picky about that. If they have those symptoms, they're being tested. So, is there likely more virus out there? Yeah, probably. And it's because it's such a sneaky virus and it's so easily transmitted when people are asymptomatic. But the fact, even cross-referencing, the 3,000 cases that Baylor Scott and White has tested, and they're having a 4% conversion rate. We've tested 575. We're having a 5% conversion rate. Basically, that means that when people are coming to our facilities seeking care, we have a very stable amount of testing. So it's not like it may help to have more testing to find more carriers, but in terms of the immediate needs of those patients, we've got sufficient testing capabilities, and it doesn't seem to be changing very much. Would that be inaccurate? I'm looking to Dr. Greenberg for a nod. He gave me one, so I'll take that. So we are not concerned, and we haven't been concerned. Periodically, we get worried about how many test kits are available, but we've never run out, and we've always been able to find them in our supply chain. And it sounds like the other providers in the community have as well. So does that suffice, Judge Blackburn?
I have a follow-up.
Yeah.
Sorry. So yesterday I received numbers from DSA that said that a request for 4,000, I believe it was swabs, were requested from Bell County and only 200 were sent. Can any of you address whether or not that's accurate then, or where you guys are getting supplies if it's not from the state?
Yes, I can. We don't get our supplies from the state. We get ours from Advent Health Supply Chain. I believe Baylor Scott and White gets it through their supply chain, and Seton Medical Center gets it through their supply chain. So your hospitals have not been dependent upon government subsidization of the test kits. I know that doesn't necessarily match up with the national conversation and, quite frankly, some of the sensationalization of that conversation, but that's the reality of your local healthcare market. And we continuously get replenishment. Like I say, sometimes we monitor our threshold of number of kits available every day. And so we always know, I know exactly how many test kits are available at any given time, and I've never gotten worried. And I believe Baylor Scott and White has been good too. I mean, they've been our supplier for, that, like I said earlier, they have been our supplier for the most, the basic foundational testing that we've had. So we've been in pretty good shape, but we're not testing everybody. And if there becomes some national, intention to do random testing and you hear about 2 million, 5 million a day, those sorts of things, those are numbers we cannot relate to right now. But if that comes, we'll be happy to participate. Is that helpful?
I guess I'm still just, so is that number from the state totally inaccurate? Was that request no?
Where we get our stuff, we're doing well. We're doing well. Thank you.
So I don't know if I'm going to misstate this. I will do my best not to, but someone will certainly alert me if I do. So what you're referring to is referred to as the STAR request. So that was made very early in this event when we anticipated the need for testing, that we weren't sure what our supply looked like. And the thing about STAR tests or STAR requests is they take a really long time. So made the request. And of course, in order to get a state assisted request, what they do is they assess who needs it the most. So if we request 4,000 of something and only get 200, it's because they said, well, we've got all these requests coming in from all over the state, and we're going to base what we actually give you on what we feel your need is. And of course, there are jurisdictions elsewhere in the state that are certainly harder hit than Bell County has been. So that's, I can't assess exactly what methods they use to make that determination, but that's likely where that happened. So to my knowledge, that was a request that was made through STAR testing back when we were kind of going, okay, we don't know what our testing capability looks like. And rather than waiting to see if it's going to get as bad as we thought it could, let's put out the request and see what we get out of it. Better to get ahead of it as fast as we can. So that, if I recall correctly, that's kind of where that came from.
Thank you.
So I'm having some folks check right now to see if we can find out when that request was made. But my suspicion is that it is, as Dr. Chadwell said, there was a request made for those. I think it was made on behalf of one of our providers here in Bell County, but I think it was also several weeks ago when that request was made, because as Dr. Chadwell indicated, it does take some time for those requests to be met by the state. And so while they may have just met that request within the past few days, the actual request was submitted several weeks ago, is my suspicion. But we can follow up with you on that and provide you when the time, what time we made that request and then what time we got it in. But I suspect that's where the lag is.
Thank you.
Any other questions?
If testing isn't an issue, what are the issues that we have right now?
I'm sorry, the first part of your question cut out, Jacob.
So we've heard from the healthcare providers that testing isn't an issue, nor is the supply of test kits. What are the issues if we have any?
Issues, well, again, issues in what respect? Issues for healthcare capacity, issues for data associated with policy-making decisions on reopening, issues in what respect? If it's healthcare capacity, again, I'll let each of them come back up if need be, but I think what they've indicated is, as the numbers at the state level indicate, there is adequate capacity for our healthcare providers across the state and in Bell County. We have, in one sense, and they have, I should say, but the community as a whole has managed this event very well in terms of following the directives and the guidance and the recommendations that have come from the federal government, from the state government, and from local government about social distancing and all of the recommendations that have been put out there. And that's helped create this capacity in the system. So I don't think there are capacity issues right now in terms of managing the COVID-19 event. From my perspective, and again, I'll certainly invite them back up, but from my perspective, the issues are assimilation, identification, assimilation, and then application of the correct data and information so that we can move forward and move out of phases that we're in and into the next phase to hopefully return to something akin to normal as we go forward. But I think, again, trying to identify what that criteria is, what the president has called gating criteria to go from one phase to another. I think there's still significant debate going on at the national and state level about what that gating criteria should be. Should it be number of positive tests for X number of days? Should it be number of deaths for X number of days and downward trends? Should it be, and you can kind of fill in the blank, there are multiple thresholds or criteria that are being discussed right now in terms of what those should be, and then what should be the policy decisions that are made on the basis of those thresholds or gating criteria. So I think that's the debate that's occurring right now, both in the health circles, but also at the policy levels, is what does that gating criteria look like? And are there resource constraints for doing that? So like the number of tests, if the number of tests are going to be a gating criteria for going from one phase to another, then what kind of resource issues do you have? And are you doing enough tests? Are just a couple of the questions that are out there. Let me, Dr. Chadwell would like to come back to the podium, and again, I'll invite any of the others if they'd like to also.
So speaking for public health, a couple of the things that jump to mind for me and as far as challenges is really more anticipated challenges rather than things that are actively occurring. So we're in this phase now where we've seen that our efforts are paying off. We're not seeing the extreme scares that we early on were worried about hospital capacity being overwhelmed. We're not seeing those things occur because we've taken steps. But that kind of lends to a sense of complacency. That lends to people saying, oh, everything's fine. I'm just going to go right back to my life as normal. We can't go from 0 to 60 immediately. And that's really going to be the hard thing to stress. I know people want to get back to normal. I know this is hard for people, but if we aren't careful about taking those steps gently, then we're going to end up in a bad position. So things might be okay right now, but we need to continue to be vigilant with masking, with hand washing, with social distancing, and take those steps carefully based on data. And the other thing that's been challenging is, and Judge Blackburn alluded to this, there's a lot of data coming out of this and trying to figure out how to utilize that and what to do with it and what does it tell us that we weren't aware of. And when you get into data analysis, you uncover a lot of really interesting patterns, and we're not at a point yet where we've been able to do as much of that analysis. We're figuring those things out now, and we're figuring out how to deal with all of the information that we suddenly have. So that's another challenge. But I think the biggest thing that I want to make sure that we drive home is that what we're doing is helping. It is making an impact. And a big challenge for public health is always that if we do our job well, it looks like we overreacted. If we do what we were supposed to do, everybody says, oh, what were you freaking out about? And that's a huge concern for us, because if we don't do things well, if the community doesn't respond to our recommendations well, then we get, well, you didn't do enough. So I don't want us to ever get to a point where they say we didn't do enough. I would prefer to be told, gosh, you just overreacted to the whole thing. It was never that bad. I'd rather take that all day long. So that's what I hope to hear by the end of this.
I just wanted to add a little piece to that. This is what we do. I think we do it really well. And we reacted quickly, and we responded appropriately, and we engaged the appropriate people. And there's a big difference between clinical and following the science and people that make the assumptions and want to dictate how we take care of things. Advent, Baylor Scott and White, Seton Medical Center, Harker Heights. We've all done, I think, a commendable job in making sure that we had test kits, PPE, and take care of the patients that come in. As Kevin said earlier, one thing we have seen are the people who are waiting way too long to come to the hospital because they're afraid to come to the hospital. We need to make sure that those people are being taken care of as well. So of issues, I would think that's one of the ones I'm seeing is the people who are waiting because everything's become about COVID-19. We still see heart attacks. We still see people with appendicitis. Those people need to not wait. We're taking care of them. We're taking care of our staff. And I just want to make sure that everybody understands we're going to follow the science. That's what we are. We're scientists, and we're going to follow the data. And I'm passionate about that as a nurse and taking care of our patients. And I just wanted to have the opportunity to say that.
So again, I think the reason there's so many questions about testing is because it's very complex. And I mentioned this before, there's this intersection and interaction between testing from a public health perspective and testing for individual patients that show up or have symptoms. We currently have enough test kits for people that are symptomatic, and we're going to expand testing for patients about to have surgery and procedures done. That does not mean every American can get a test if they want it. So it's an odd analogy. It's the best I can come up with right now. It's like asking the question, do you have enough gas in your car? Well, it depends on where you're going, because you may or may not have enough. You may have too much. Right now, there's plenty of gas. Different story. But it's a hard question to answer when we are in the middle of everything. We're not even close to the end. If you look, we are, quote, past the peak. Well, we may be past the first peak. The behavior of viruses is such that there's likely to be a second peak. And that's why we continue to caution about social distancing and continuing with the non-pharmacologic measures to address this virus. So we are in the middle, and that's why I think there's a lot of confusion and frustrations because we're in the middle of it right now. When we get to the peak, people I think there's thoughts, oh, we hit the peak, so everything's going to be better tomorrow. But we're in it for the long haul, and our world actually has changed.
I do have a quick question for, sorry, just while you're.
Almost. Yes.
I just have so we've gotten some message, and this is only directed to you because this is, most of the people that talk to us are your patient. They've sent us screenshots of messages from their doctors or told us that their doctors are telling them, hey, looks like you have all the symptoms, but we're really frustrated because we don't have enough tests to test everybody. We can only test the really sick people. Are those just outdated messages, or what would you say to that, I guess?
So we do not, clinically, everyone does not need a test. We call it the duck theory, that walks like a duck and quacks like a duck, it is a duck. So if it looks like you have COVID, you have COVID. We actually don't need a test to confirm that. That's no different than the flu. So if somebody comes in, say they came in last December before COVID was even a word, and they said they'd been exposed to somebody else who had the flu and they have all the symptoms, they have a headache, they have a fever, they feel terrible, they have the flu. It doesn't actually matter for that individual patient and for me as their physician if their test is positive because they have the flu. And tests are not 100%. There is no test out there that's 100%. And there are issues with the testing because we haven't really demonstrated it. To get a correct sample from the nose, the Q-tip has to go way back. Most people would say they feel like it's going through their brain. It's a long Q-tip, it goes way back. It has to be twisted, you have to get a good sample, and it has to be transported appropriately. So there's a lot of steps in that testing process that can come up with what's called a false negative test. So we do not over rely on a negative test when the patient is sitting there and everything says they have the disease. So if somebody is ill, but they don't need to be in the hospital, the recommendation, no matter what, is going to be stay at home. And you've assessed the other people around them, they probably don't need a test anyway. Again, that's different than the public health approach where you test everybody to see what the prevalence is.
Right, I'm curious how many people you're saying probably have it but don't need a test, just for a public health understanding, so we know in our area how many people are out there with it.
So yeah, asking if we know what we don't know, how many, for every person that's positive, how many more that we haven't tested are positive? And again, I'm going to look at Dr. Chadwell. It's somewhere probably around 1 to 10. You think? We just, again, we don't know. We do not know because we haven't done that. We haven't done the true public health testing where you test every single person out there. So testing somebody that shows up with symptoms or an exposure is very different than standing out in the parking lot at a shopping center and literally catching everybody that walks by. Those are two very different approaches. They're both important, but they're very different.
Right. I'm asking more if you guys are tracking, like you said, the duck situation, somebody that it looks like they have it, you're telling them they have it. Are you keeping track of those numbers? Of people coming to your hospital and your doctors are saying you probably have it?
So that is a struggle we have had because just like there was no test previously, there were no diagnosis codes for this disease 3 months ago. So we track everything through medical records. We track it through our electronic registries. We do have a registry, but that is all, again, in progress. And so it's a moving target, and we have to have the way to categorize someone who is what we call COVID positive. You can be COVID positive by testing or COVID positive by your clinical presentation and the fact that you have all the symptoms and you meet the criteria. So I'll say the big we, because as a country and a world, we are just now able to start doing those things.
I'm going to expand on that real quick if I can. So we get calls similar to what she was just talking about. In fact, there's a woman who literally just called us. So what do I tell the woman who says her husband has all the symptoms except for one and they won't give him the test and she doesn't know what to do? Is that the case? You've got to have every single box checked to get a test, or how does that work?
So every case is different. I don't know the age of that person. I don't know what what's called comorbidities. I don't know their other disease processes, what their exposure are, how many days they've been sick. Every bit of that goes into a decision to test. And additionally, what goes into a decision to test is, do you really want that person who is now staying at home, which is where we're going to tell them to stay anyway, do you want them to go back out in the public? So again, these are complex decisions. And you have to know all of the specifics.
I have to ask again, I guess, comfortable with the number of positive cases that have been reported, knowing that there are cases like this that are told to be at home. If we have an accurate representation of the pandemic here, if everybody's showing symptoms aren't being tested. That might be more for Dr. Scott.
Yeah, so that's more of a public health and statistical answer. I will tell you, as a physician, I make diagnoses all the time without a test to tell me what that diagnosis is. I'm very comfortable with that. That's the appropriate practice of medicine for that individual patient, especially when it is something where all of the treatment is supportive. And if your case is mild, it's Tylenol, Advil, fluids, rest, and staying away from other people, which is really what we're talking about for mild cases of COVID. So from a healthcare perspective for individual patients, we do have what we need to take care of them. So I think Dr. Chadwell I'm going to throw her under the bus.
There's some math on here.
Okay.
So when we talk about disease prevalence, disease incidence and prevalence, it doesn't matter what condition you're talking about. It doesn't matter if it's COVID, doesn't matter if it's flu, doesn't matter if it's cancer. Not every single person is ever going to get testing confirmed, public health testing confirmed. We've got about, I think, doing the math in my head here, about a 4.5% positive rate, which seems to jive with other positive rates being measured in other places. And again, it kind of depends on what you're looking at and what testing protocol looks like and all of that. But it makes sense from a mathematical perspective. Now, again, you're not testing every single person, but even with the flu, if you look at influenza data, you generally have positive for flu A, positive for flu B, H1N1 testing. That is a very small sample of the total number of people that might have flu at a given time. We also look at ILI, which is influenza-like illness, and all that is a measure of the syndrome. How many people check enough boxes to say they probably have the flu? That's kind of what Dr. Greenberg was talking about. That's that clinical diagnosis. Do we count that as a flu case? No, because it's not a tested flu case. But again, it gives us a sample representation. So when you're talking about things like this, think about a scientific study. What's one of the first things they tell you? We sampled this many people, right? And that gives you an idea of this is kind of what it's representing in the population. So 4.5% positive rate, that tells us something pretty useful. It tells us that we're flattening the curve here. It tells us that we have a relatively decent sample. Again, it's not everybody. We know it's not everybody. You know it's not everybody. We know there are people with clinical symptomology, and we ask that they follow their doctor's directions. But we do have a decent representation of illness in the community. And as we do more testing, we're going to get better statistical data on that to represent that even more effectively. Does that answer your question?
Absolutely. Thank you very much.
You're welcome.
Okay, we've been going for about an hour and a half, so I think I'm going to close this here shortly. I will say this, though. I'm going to chime into that question as a non-healthcare professional. Everybody you've heard from the doctors, from all of the folks, have been answering that from a healthcare perspective. And I want to answer it back to, again, from a non-healthcare professional standpoint. What I have understood throughout this whole process is that the testing process is a data point, and it's also a medical assessment point. But in terms of the number of tests that are done, from a policy standpoint, testing the entire population is neither practical nor advisable by the health authorities or by the policymakers. So from a practical standpoint and from a health protocol standpoint, health treatment standpoint, it's not necessary and it's not practical to do. The discussion that's underway right now with regard to tests is what I said a minute ago, and that is there is a big discussion going on right now, mostly at the federal and the state level, about what do you do with the tests that we have right now, and do those need to be ramped up, ramped down, not ramped down, but ramped up, and is it confirmed cases? Is it just the total number of cases? You know, what's the denominator over the numerator in terms of assessing the trend that we're seeing? But from a medical treatment standpoint, as I think Dr. Greenberg indicated, there's not a need from a medical treatment standpoint to test every single person who potentially demonstrates COVID-19 symptoms. That's not required from a medical treatment standpoint. Again, all of that is said from a non-healthcare professional, but that's been my interpretation and my observation over the past several weeks, months, years, however long we've been doing this, that in the discussions that I've been in relative to what these tests mean and the value of those. But I do believe that the value of the test, the type of test, the number of tests are all part of a discussion right now as we go forward in terms of how we take that data, expand it, enlarge it, or hone it as we decide to make, as policy decisions are made to go forward about how we begin to step out of this and when we begin to step out of it and under what terms and conditions. Okay, I'll take one more question and then we'll close. All right, not seeing any. I want to thank all of you for participating today. I want to say thanks to our healthcare professionals that were here today. Very much appreciated your presence here today. We'll do another press conference next week. As I said, as I indicated earlier, Governor Abbott, I believe, is tentatively scheduled to hold a press conference on Monday. My intent at the moment is to follow that press conference by maybe a day or so, but I certainly want to give the governor an opportunity to make his announcements and issue his executive orders, whatever those may be, and then we'll respond to that, and again, we'll conduct our press conference. All right, thank you very much.